Welcome to the Roger Sploman Conference and Learning Center at Trinity Health, Muskegon. Many of you probably, it's the first time you've been in this beautiful facility, and I never like to see people I know in here anyway, so it's good you're coming for a great event. So my name is Gary Lohr. I serve as the president for Trinity Health here along the Lakeshore, now with Muskegon and Shelby and Grand Haven. So we really appreciate our partnership and this event. I mean, we are so excited. We've been working with Muskegon Community and with Grand Valley for so many years, and to come here together and celebrate this partnership and kind of the next natural evolution of this partnership is so exciting. So I've been in the organization for 20 years. I've been in this role for about 8 years now. I'm going on my 8th year now, common connection for me is I got my MBA at Grand Valley, and about half of my classes I took at Muskegon Community. So totally appreciate getting that advanced degree and staying at home. So and that's kind of the plan here. So we are so excited. I mean, if you think about our organization, we have about 4,000 people that work for Trinity Health in Muskegon, and so many of our colleagues have gone through the health-related programs at Muskegon Community College. So the 5,000 or so people that go to community every year, the MA program, the surgery tech program, the respiratory tech program, we are grabbing kids from those programs every single year, and we need every one of them in this organization. So those are some of the other programs. We're obviously here to talk about the RN program, and from a community perspective, we have roughly between our 3 campuses, we have about 1,000 nurses that work in the organization. And if you just think about any given year, you'll have in the 10 to 15% turnover. So we have 150 nurses-ish leaving every year and coming in every year. And so my only thought is the more we can keep Muskegon kids going and getting their 2-year degree and then their 4-year degree in this community and then staying here to work, we can basically hire every single one of them that wants to stay in this market. So, and we want to do that. So just known John for a long time. John is on one of our local boards. He's on our Trinity Health Grand Haven board. So we have a very close connection, and just so pleased to talk about this great program. And I'm going to turn over to John to let him really talk more about the program. But welcome to Trinity Muskegon, and it's great to see a great turnout.
All right, well, thank you, Gary. I truly appreciate and certainly appreciate the partnership. And thanks to all of you for joining us here as we celebrate this decades of partnership with this new innovative program. And we're certainly in the right place. At Trinity Health, we're right here, and because their central location provides high-quality nursing and exceptional health care. And of course, our partner, Grand Valley State University. We've had a long history with Grand Valley. Our student is the #1 transfer institution for Muskegon Community College students, and so we're proud of that. But together we're transforming the healthcare education by elevating nursing talent here in West Michigan and meeting the healthcare needs of our community. The ADN, the BSN pathway tears down these transportation and financial barriers our students have faced for years. And it allows them, though, to live, to learn, and to work here right in Muskegon County. The collaboration between Muskegon Community College, Grand Valley State University, and Trinity is more than just an academic pathway. It's a bridge to better health care. Muskegon Community College has a strong history, and like Gary said, a strong history of our academic success with our LPN, ADN programs, and now our graduates have a clear and more accessible path to achieving a BSN degree. The demand for the bachelor's prepared nurses is growing, and as more hospitals pursue magnet status and the patient's needs grow even more complex, we must prepare nurses to meet those standards. And this partnership hasn't just been about the immediate nursing shortage. It's about talent development and economic mobility in this community. And so together we're creating these pathways for students who may not otherwise have this type of access to a BSN, thereby empowering them, elevating their career prospects, and strengthening our local a healthcare ecosystem. I'm proud of this work and each of our partners and their deep commitment to student success and community impact. Together, let's continue this momentum. So thank you. We're pleased to be here, a part of this. And like Gary was saying a little bit earlier, this ability to impact this community, I mean, you can't say enough about it. It's just huge, it's significant, it matters, and we're part of it. And thanks to all the partners as well. We're going to continue to do this type of work in this community. So thank you, thank you, thank you. And I know somebody else is coming up after me. From Grand Valley, all the partners from Grand Valley. Okay. So, okay.
Greetings, and can I say what it is, a beautiful day it is to be in Muskegon, a little windy, but it's sort of crazy that it's like 80 degrees and we're almost in November. I know it won't last, but that's okay. But it's really great to be here celebrating this partnership really between three great organizations, MCC, GVSU, and Trinity Health. My name is Kara Van Dam. I'm Vice President and Chief Executive of GVSU Omni. We're a division at Grand Valley State that is really focused on making impacts, deep impacts across the state, and our motto is learn where you live. So I think this really is a perfect example of the type of partnerships that we're building. My deepest gratitude to Dr. John Selman, President of Muskegon Community College, Trustee Carlson as well, and the entire leadership team of MCC for arranging this remarkable event. And my additional appreciation to Trinity Health Muskegon leadership for inviting us here today, in particular President Alora and Chief Nursing Officer, CNO, I'll go with that, Linda Dunmore. This partnership would also not have been possible without the deep collaboration between our respective nursing programs. My gratitude to GVSU's Dean of Nursing, Linda Lewandowski, who you'll hear from shortly, and Dean of Nursing and Health Programs at MCC, Lisa Gatti-Arnold. You will also, and I think this is really the most impactful thing, shortly be hearing from students who have experienced the power of partnership between our two institutions. Finally, I would like to acknowledge my colleague, Director of Central West Michigan, Shawn Jenkins, for her advocacy for the city, her hometown, for her deep passion for both MCC, she's a proud alum and she brings it up all the time, and Grand Valley State University. Strong partnerships are built on shared values, and core to the values of all three of our organizations is meeting the economic and social development needs of our communities. And we believe that education is most successful when it's grounded in the principles of accessibility and affordability. And through this partnership, we lean into that. Collectively, we know we can make meaningful community impact by developing a well-prepared, highly skilled workforce that will meet the challenges of our communities tomorrow and beyond. And with that, it gives me great pleasure to introduce Linda Dunmore, Chief Nursing Officer of Trinity Health Muskegon.
Hello everyone, I'm Linda Dunmore and I've had the pleasure of serving as the Chief Nursing Officer for Trinity Muskegon for the last 3.5 years. I've been in this organization for 35 of my 40 years as a nurse, and had I been born and raised here, I would have proudly attended MCC and GVSU. But I'm from Cleveland, so I went to a diploma school there. But this is now home for me and I'm really excited about that. And I just want to talk a little bit about the power of partnership and how we have partnered. So as I reflected on a variety of things that I've been involved in over the years with MCC and with Grand Valley State University, one of the things I can remember is when I was functioning over the education space and we had our simulation and we brought our nurse residency program back to life and traveled to GVSU to have standard patients. And that was just an awesome experience to see them, the nurses in our residency, growing and learning and networking, and just the support and the beauty of the campus we saw at Grand Valley, so I'm grateful for that. And then as I entered this role, it wasn't my brilliant idea, it was our staff's brilliant idea that said, Linda, if you were wanting to do something creative, you should bring the nurse extern program back. And so we partnered with MCC, and we now have a lot of nurse externs. Actually, I don't even have to sell the program hardly anymore. They sell it for me, so that's really good. And that's a chance for students to come as a student and be aligned with a nurse preceptor so that they can get 32 hours a month with a nurse and really see that live action. And this was really important during post-COVID years when their clinical time was very limited. So we love our externs, and our staff are just really, really excited to have that program back. And you know, when we moved into this beautiful building, it was really, really an opportunity for us to even bring students to say, we're going to move patients from the Hackley campus to the Mercy campus. And I think oftentimes, one would think, well, that's not the time, we don't have time for students, and we welcome them. And our MCC students were just top-notch, helping us, asking questions, and we wanted them there because we thought, you're never going to see this again, maybe in your career, unless maybe you're going somewhere else. But just the learning and the partnership and how they helped us care for our patients during that very delicate time was significant for us. And so I just want to say thank you to the students and to the MCC. And certainly, I just can't thank the faculty of MCC enough. I've learned to get to know many of them. Many of them are nurses here or have been nurses here and transitioned to faculty. And I am just honored to work with the faculty of MCC and GVSU in this role. So thank you for being here. Thank you for helping support us. And we will continue this journey, Dr. Selman, and look forward to many more partnering opportunities. So thank you. And I think I am inviting up Linda Lewandowski.
Thanks, Linda. It's really exciting to be here. I haven't been here quite as long as Linda and Lisa and I are kind of about in the same boat. Been here 4 months. So one of the things I've quickly learned, though, is that this partnership has really preceded this exciting appropriation project, which we definitely thank Dr. Carlson and all the legislative people who really made this happen, because it's really a game changer for so many nurses in this community. This program, I'm supposed to be talking about specifically some programs, so I'm going to tell you some of what you probably know, but this program results in the transition of ADN nurses to BSN prepared nurses in a way that's really going to directly impact the health and well-being of your community. The increasing complexity of healthcare in today's fast-paced world demands a higher level of education and training, and a BSN provides nurses with essential skills and knowledge that directly enhance patient outcomes. Various studies have really shown that healthcare facilities with a higher percentage of BSN prepared nurses show reduced hospital readmission rates, fewer complications, lower mortality, shorter lengths of stay, and better patient satisfaction. So yay for Trinity here, because you are going to really be enhancing not only the careers of your nurses and the mobility and ability to move into leadership positions, but also the health and well-being of your patients. So it's a great thing all around. As you probably all know, a master's or a bachelor's degree requires 120 credits, and the ADN nursing component from MCC will bring in 36 credits for our students. And then with the prereq courses and their general ed courses, and then our 30 credit RN to BSN nursing courses, all adds up to 120. And we are very vigilant also in this program. One of the elements is having early advising. And so our nursing advisors come to MCC from GVSU and really make sure that the students are getting all of the right courses that are going to transfer to really make sure that this is a seamless pathway. Our program is an RN to BSN program that's online with asynchronous and synchronous courses, but we use a cohort model. And so for nurses who aren't really sure if they really want to do this online thing, we have meetings, and Linda has graciously agreed that we can have them here at Trinity because a lot of the nurses work here, to have students meet with each other and with a faculty member, because that not only helps kind of get them used to the whole idea of the model, but it also gives them supporters and learners who they can really rely on to support each other. And so having that social support and a cohort model, we think is a very important part of the program as they learn in their own community on their own time, because it's online, so that's always a great thing. Some of the content, people ask me, well, what do you teach them in this program? Well, a lot of the content relates to research, evidence-based practice, safety and quality, professional identity, informatics, emergency preparedness, leadership, community, and population health nursing. So really augments the great learning they've already had in their ADN program, and really adds additional elements that really provide the evidence base and the leadership qualities that can kind of help nurses move ahead in their career. Another important outcome of having the grant from the state appropriation is that we will be hiring a couple of coaches, Lisa will at MCC, who will really be able to be cheerleaders and supporters of our cohort of nurses. So not only will we have advisors from MCC and GVSU, but we also will have a couple of really dedicated coaches who are going to be supported by some of the state appropriation funds. So we're very excited about this tri-partnership. We're already talking about other ways that we can partner even beyond this. Although, if some of the state, people with connections out there wanted to get us another appropriation from the state legislature, we would be so happy, because we just didn't anticipate how fast students were taking this up, right? I mean, we were hoping to get 10 or 15. We had like 25 or 30 right out of the get-go. So we have 22 students that started already this fall, and we have about 3 or 4 more starting in January. I know it's really exciting, and we hope that maybe we can get more funding so we can keep this going. So thank you all very much. We're excited to participate.
Hi everyone, my name is Lisa Gatti-Arnold, and I am the Dean of Nursing and Health Programs at MCC. Like Linda, I'm a little bit of a newbie. I've been here for 4 months, and there are a couple people here who I need to thank, who really did a lot of the legwork from our side for the grant. And one of them is here. She's also working right now, and that is Kim Mason. She is one of our nursing faculty. Will you stand, please? And she's been involved from the beginning, and so I go to her quite a bit. I also see Dr. Kelly Conrad here, who was working on this from the beginning, and Chris Patterson sitting next to her. Will you ladies please stand? Thank you. Thank you so much. I am very grateful to be able to kind of continue the work with the grant. And we're very grateful for this grant. It is really providing some much needed support, equipment, support for student learning in the form of those coaches for the students, and as well as economic support, financial support for students who are currently enrolled, and breaking down those barriers for students who would otherwise maybe not be able to do this at this time. When the grant ends in September of 2026, we really hope to have provided BSN education for between 25 to 30 nurses, if not more. And I would definitely advocate for that continued funding if anyone has any insight there. I want to say, Dean Lewandowski spoke about a bachelor degree nurse and what that can bring to healthcare. And I want to say too that I really have always valued associate degree nurses, and we are proud of all of our MCC graduate nurses. And as someone who's worked in community colleges and with nursing students in associate degree programs, I've always encouraged them to continue their education. With my own education and the profession of nursing have had a very profound impact on my life. And our partnership with Grand Valley streamlines this education process for our nursing grads to continue for their Bachelor of Science in Nursing, which I hope will also increase their understanding of the depth and the breadth of nursing and what it means to be a nurse, as my education did for me. We have some very special MCC graduates joining us today who are enrolled in the RN to BSN program through GVSU with the help of the grant. And so I would love to call one of them up. And Kaylee Prince is an MCC graduate, class of 2024, who is an ADN to BSN grant recipient.
Thank you. My name is Kaylee Prince. I'm a licensed RN, graduated from Muskegon Community College this spring. I currently work as a nurse floating between medical, surgical, ED, and ICU units. As a new graduate nurse, I heard rumors that there might be an opportunity for further education through Grand Valley. But since it seemed to be too good to be true, I wasn't really sure if it would happen, but here we are. So, growing up, I remember believing I didn't have the smarts or the finances to go to college, much less get a degree in healthcare. God had different plans and He used you. Currently, I'm in my first semester at Grand Valley, taking a nursing research and pathology class. It can be challenging just learning the ropes to a new position, adjusting the night shift, staying on top of classes all at once. So I really appreciate the online component. I hope that this bachelor's degree will not mark the end of my formal studies. I would love to pursue my master's or doctorates of nursing in the future. I also desire to look for ways to volunteer. It'd be fun to host like a community CPR class or help out family and friends as the need arises. One of my favorite things is talking to recent high school graduates who are considering the medical field as a career choice. I tend to geek out about anything medical, so I have to watch it sometimes, especially like their eyes glaze over and I'm like, ooh, that's enough, moving on. But again, this wouldn't be possible without you. My dad is also super proud because he is a GVSU alumni, and soon I will be too. So what a privilege and honor it is to stand here and thank you for this opportunity. God has used you to impact not only me through this program, but also to impact patients in West Michigan through that my classmates and I will be able to serve throughout our career. Never forget that your role is indispensable. Know that wherever you've been placed is not an accident. You are there for a reason, and you have been gifted with a personality and abilities that are uniquely yours. And thank you for using your position and influence to bless others. So, thank you.
Thank you, Kaylee. And we also have Marissa Johnson here, also an MCC graduate, class of 24, another ADN to BSN grant recipient.
So my name is Marissa Johnson, and I'm a nurse here on our 6th floor at Trinity, the Progressive Care Unit. I'm also an April 2024 graduate. So I've actually been with Trinity Health for 9 years now. I started right out of high school at Hackley Hospital as a CNA on the med-surg floor. And then while actually attending Grand Valley, I got my EMT license and then finished my So I received my EMT license and then worked in the ER for a while I finished my education at Grand Valley, which I attained my bachelor's in social work. My career goals changed though in the fall of 2020 when I myself had to have open heart surgery for a congenital heart defect. So that kind of changed my interest from social work into nursing. Since beginning nursing school though, my career goals have changed. At first I wanted to be an ER nurse, thought it was awesome, then a pediatric nurse, not so much for me. And then started on the 6th floor and fell in love and found my niche with cardiac patients. I look forward to learning as much as I can here with my current career, with my end goal of becoming a cardiovascular ICU nurse. So I'm a huge advocate of the saying, never stop learning. And continuing my education is a huge part of furthering my career with attaining my bachelor's in nursing. I hope to expand my knowledge on nursing to learn more on the evidence-based practice and use that as a stepping stone for further expand my nursing career and maybe one day go into nursing education. This partnership between MCC and Grand Valley is something that I am very excited to be a part of. Thankfully, this program allowed us to either start in in September of 2024 or winter of 2025. And with adjusting to life as a new grad and planning a wedding, I decided to start in the winter of 2025. One of the main reasons that I chose the GVSU RN to BSN program is because of the flexibility of the start date, not having to commute to Grand Rapids or Allendale, and then having the support that I've already received from the Grand Valley staff. I also may be a bit biased, but I'm also already a GVSU alumni. I'm extremely blessed to have received my RN degree from Muskegon Community College and look forward to officially beginning this partnership with GVSU in a few months. I want to thank you all for allowing us to come talk about something that we are both so passionate about.
Thank you, Kaylee and Marissa. This is why we do this. And thank you for telling us your stories. And you're both amazing. So I wish you the best. And once again, Dr. John Selman.
Okay. I'll follow the list this time. So, boy, testimonies are so powerful with the students. Thank you. Thank you for telling your story. We really appreciate that. It's just, this year at Muskegon Community College, one of the things we're focusing on is advancing teaching and learning excellence. And so that's what I was hearing here when people talking about excellence. And so, and I appreciate all the partnerships that we have. I do want to take an opportunity to introduce my board member, I think, Dr. Crane, Dr. Don Crane, who's my board member, who's long-serving board member and who is really guiding the board. And certainly appreciate his support and service to the people. So, Dr. Crane, please stay on. So the next part, I think, is about photos. So we're going to do photos here, and the individuals that were presented or spoke today, we'll start with, so why don't we start with individuals that spoke, and we'll just take some photos and then kind of interact, right? And then continue that work. So why don't we? Yeah, why don't you go ahead and grab some food while we do some photos.